Hi, my name's Dr. Beck Bennett, and you're tuning into the AIMER video series. Today, in video 10, we're going to explore the human side of hearing care. We're going to look at clinician qualities that make a difference, and we're going to take a deeper dive into how we show up as clinicians. This is going to allow us to explore the role we play, personally and professionally, in supporting our clients as they navigate the social, emotional, and mental well-being impacts of hearing loss. A couple of years ago, I collaborated with Audiology Australia, our national peak professional body for audiologists here in Australia. Together, we conducted a Delphi study. Our goal was to reach expert consensus on the specific clinical practices that hearing care professionals can use to support clients who present with emotional or mental health concerns related to their hearing loss. We brought together a diverse panel of experts, including hearing care professionals, psychologists, researchers, and importantly, people with lived experience of hearing loss. Our experts together developed, rated, and refined a list of practices over the course of 3 Delphi rounds. In the end, the panel reached agreement on 123 best practice statements grouped into 8 domains, including communication, emotional support, personal qualities of the clinician, interventions, and organisational systems. These insights are more than just suggestions. They represent a shared vision between clinicians and clients of what best practice wellbeing-informed audiological care could look like. Let's walk through them one at a time. The first domain is detection. Detection was described as the process by which clinicians identify signs of emotional distress, mental health needs, or social well-being concerns that may be impacting the client's experience of hearing loss. Now, this could be formal, using a structured tool, or informal, emerging through observation or conversation. We heard about 3 main ways detection tends to occur: client disclosure, audiologist recognition and inquiry, and screening tools. First, let's talk about disclosure. So many clinicians said that clients often disclosed emotional concerns on their own, but usually only after trust had been built. Now, this often happened once they felt safe, heard, and understood. Disclosures could sound like, "I just don't go out much anymore. It's too hard to follow conversations." Or, "My hearing makes me feel really stupid at work, and I'm worried people are getting fed up." As clinicians, we might respond with, "That sounds really tough. I'm glad you told me." Or, "I can hear how much this is affecting you. Would it be okay if we talked about that some more?" Even a small acknowledgement can open the door to a deeper conversation. The second one was audiologist recognition and further inquiry. So clinicians often told us that they noticed signs of distress, like a shift in tone, tearfulness, withdrawal, or frustration. But many said they didn't typically ask directly about mental health unless the client brought it up first. Now, I get it. In busy appointments, it's easy to move on, but with a simple question, we can pause and explore gently and really build that trust and that therapeutic relation early on in our relationships. Here are some ways to open that kind of conversation. "I noticed you seemed a bit overwhelmed. Can I check in with how you're feeling about all of this?" Or you might say, "You've mentioned a few things that sound like they've been really hard lately. Would it be helpful if we talked through that a bit?" These are invitations, not interrogations. They give clients permission to share if they want to, and they send a clear message that it's okay to talk about this here with me. So the third approach was screening tools. Now, some clinicians did use screening tools, but most of them were unsure about when to introduce them or how clients would respond or what to do next if the score indicated distress. Using a tool can feel formal, but when introduced with warmth and purpose, it can open helpful conversations. You might say, "Would it be okay if I asked you a few questions about how you've been feeling?" Some people find it helpful to reflect on how hearing loss might be affecting their mood or well-being. Or you could introduce it by saying, this is a short well-being screener we sometimes use to get a clearer picture of how things are going emotionally. It can help us work out the best way to support you. And then once you've used the tool, it's critical to follow up. Thanks for filling that out. I noticed a few areas where things seem really tough right now. Let's talk about what kind of support might help. These moments give us a window into the client's experience, but we need to know how to respond when that window opens. Let's look more closely at these screening tools, what they measure, and how they can be used safely and supportively. So when we talk about detecting wellbeing needs, screening tools come up again and again, both as an opportunity and as a challenge. And when we say screening tools in audiology, we're generally talking about two broad types, each serving a different but complementary purpose. So first, let's look at audiological wellbeing screening tools. Now, these tools help us understand how hearing loss affects a person's emotional well-being, social participation, and communication confidence. They're focused on the impacts of hearing loss itself. For example, the revised hearing handicap inventory screener screens for the emotional and social effects of hearing loss. It helps us to understand how much the hearing loss is impacting on a person's daily life and emotional state. Similarly, the Social Participation Restrictions Questionnaire measures restrictions in social engagement and activity due to hearing difficulties, particularly in group settings and public environments. Psychological tools, on the other hand, these tools assess mental health more broadly, things like mood, anxiety, loneliness, and general well-being. They're not hearing specific, but they can give us valuable insight into a client's emotional state. For example, the Warwick-Edinburgh Mental Wellbeing Scale focuses on positive mental well-being and resilience, measuring things like optimism, energy, and connectedness, things that can be impacted by hearing loss. There are also screeners for anxiety, depression, and combined anxiety-depression scales. So using the right tool at the right time for the right client allows us to tailor care to the whole person, not just their ears. What do hearing care professionals generally think about using psychological wellbeing screening tools in audiology practice? Well, to find out, we conducted a qualitative study where we interviewed 13 hearing care professionals to explore their current practice, knowledge, and training needs when it comes to identifying and supporting clients experiencing psychosocial concerns. There was a definite interest in using screening tools, but clinicians told us that they needed tools that were brief enough to fit into tight appointments, practical in terms of scoring and interpretation, but also non-threatening, meaning both acceptable to the clinician and appropriate to the client. One clinician summed it up beautifully. You can teach me how to screen, but I also need to know what to say next. And they're absolutely right. If we choose to use a screener, we also have a responsibility to know how to interpret the results, open up a conversation about what the score might mean, and co-create a plan to support the client moving forward. This doesn't mean diagnosing a mental health condition, that's not within our scope, but it does mean expressing concern when appropriate, validating the client's experience, and helping them to take the next step towards support. And don't forget the no wrong door approach, where at any point in care, including audiology, we can be the right entry point to emotional support and recovery. We may not be mental health experts, but we can be the door that opens access to the help our clients need. Having explored how we detect wellbeing concerns, the second domain that came through strongly in the Delphi study was education. Now, if you've been following this series, you'll remember that we touched on education earlier, back in video 4, when we explored the second step of the AIMER framework, inform. In that step, education was about providing general information, helping clients understand that hearing loss can affect more than just sound, validating their experience, helping them realize they're not alone. But here in step 3 of the AIMER program, M is for manage. Education becomes something more. It shifts from understanding to empowerment. Now we're offering clients the knowledge and strategies to actually do something, to take meaningful action that improves their social and emotional well-being. So this might include practical tools like pacing conversations, preparing for noisy or emotionally challenging social situations, or using assertive communication to express their needs more clearly. It also includes helping clients know when to reach out for peer support, mental health services, or simply to re-engage with activities and relationships that give them joy and purpose. To support this phase of care, we've developed a suite of client information sheets. These are clear, accessible, and designed to be taken home, so the learning doesn't end when the appointment does. In this way, education becomes a tool for self-management and one of the most powerful things we can offer in supporting our clients' well-being. The third domain in the Delphi study focused on something fundamental: communication. In the manage phase of the AIMER, we're supporting our clients to set goals, adopt strategies, and reflect on how they're coping. And one of the most effective ways we can do this is through skilled, compassionate communication. In our Delphi study, this came through loud and clear. What clinicians say and how we say it can have a profound impact on client outcomes. So, how do we put this step into practice? Well, here are 3 techniques drawn directly from the Delphi themes. One of them was to practice active listening and open body language. Put down the tools, turn your body towards the client, and maintain gentle eye contact. Nod. Use short verbal encouragers like, that makes sense, go on. These small actions say, I'm with you, I'm hearing you, you matter. The second approach that kept coming up in our Delphi study was to allow space for silence and emotional expression. Silence can feel awkward, but it's often in those silent pauses that the most important things are said. So try to resist the urge to fill the space. Trust that silence has value. And the third approach that kept coming up in our Delphi study was ensuring that the client feels safe, heard, and respected. We do this not only with words, but with tone, posture, and presence. We need to let go of judgment, stay curious, and reflect what we hear and check in. You could say something along the lines of, does that feel like something we could explore together? And so effective communication creates the conditions for insight, and insight leads to action. The fourth Delphi concept was provision of emotional support. This is what many consider the heart of the AIMER manage phase. This is where the therapeutic relationship deepens. It's not about fixing. It's not about giving advice or rushing to solutions. It's about creating a space where clients feel safe, emotionally safe, to explore how they're really doing. Participants in our Delphi study identified a whole range of approaches that hearing care professionals can use to provide emotional support, but these 3 were most prominent. Validation. It's about communicating that we believe their experience is real and important. Empathy and warmth. This means allowing emotion to exist without needing to make it better. We might say, that sounds incredibly frustrating. I can hear how much it's impacted you. Sometimes the most therapeutic thing we can do is to stay with them in that feeling. And the third is non-judgmental encouragement. This manage phase is about change, and change doesn't happen in a vacuum. It happens within a relationship where the client feels safe enough to be vulnerable, strong enough to reflect, and empowered enough to try something new. That kind of relationship, that's what we call the therapeutic relationship. In counselling and psychology, the therapeutic relationship refers to the working alliance between clinician and client, a collaborative partnership based on trust, respect, and shared goals. Carl Rogers is a leading figure in counselling theory, and he described 3 essential conditions for that relationship. Empathy, the ability to truly see and feel from the client's point of view. Congruence, being authentic, genuine, emotionally honest and present, not clinical and detached. And unconditional positive regard, offering acceptance and compassion, no matter what the client brings into the room. These principles weren't developed specifically for audiology, but they apply beautifully. And research tells us this kind of relationship is one of the strongest predictors of positive outcomes, often even more powerful than other more tangible interventions. In other words, the relationship is the intervention. So what does this mean for us as hearing care professionals? Well, we may not be therapists, but we are often the first point of contact for clients dealing with the emotional and social consequences of hearing loss. So when a client shares that they're ashamed, lonely, or stuck, the way we respond really matters. If you reflect on your conversations with your clients recently, are you creating a space that feels safe enough for them to keep going, share the social, emotional distress they might be experiencing? Are you offering presence, not just expertise? Are you giving them time to speak without jumping to fix or minimize? Because when we do, we give them more than just hearing care. We give them a chance to feel whole again. Let's look at the fifth concept, personal qualities and the attitudes of the hearing care professional. This is foundational. It's about who we are in the room, not just as professionals, but as people. The Delphi panel reached consensus on 22 separate statements in this area, each one reinforcing the importance of being emotionally attuned, adaptable, and committed to person and family-centered care. Together, these statements highlight the need for us to be culturally sensitive, non-judgmental, collaborative, self-aware. They encourage us to take the emotional and social impacts of hearing loss seriously and to develop the skills and confidence to explore these impacts with our clients in a respectful and responsive way. 3 key behaviours really stood out as essential for embedding wellbeing into everyday audiological practice. One was to be responsible for continually developing your own professional counselling skills. Emotional conversations are part of our role, and we need to feel equipped to handle them well. This means seeking out training, making time for reflection, and actively building our communication toolkit. It's not about being perfect, it's about staying committed to learning and growing. The second was around maintaining a non-judgmental stance and cultural sensitivity. Our clients bring diverse stories, beliefs, and values. So what may seem small or clinical to us might feel monumental to them. Our job is to meet every client with respect, humility, and curiosity, and to create space for whatever they bring. And the third is being willing to adapt our approach to meet each client's needs. If something's not working, pause, reflect, recalibrate. Ask the client what would feel more helpful for them. Be open to collaboration with other professionals. And remember, flexibility is a key ingredient of truly person-centered care. Let's now turn our attention to the 6th Delphi domain, interventions. When we talk about interventions in the context of well-being, we're not referring to long-term psychotherapy. We're talking about in-scope, practical strategies that hearing care professionals can use to support clients with the emotional and social impacts of hearing loss. The Delphi panel reached consensus on 11 intervention-related actions. The 3 highlighted on this slide here reflect core activities that hearing care professionals can feel confident offering. We might offer simple in-session strategies to reduce distress or overwhelm. This could be a gentle breathing pause, slowing the pace of the session, simply acknowledging and naming what the client is feeling. These small moments send a big message. Your feelings are valid and you're not alone. The second collaboratively sets goals that include emotional or relational outcomes. Yes, we often focus on hearing aid use or communication strategies, but clients may also want to rebuild confidence, reconnect socially, feel more in control of their lives. Helping them name those goals and work towards them can be incredibly empowering. And the third looks at supporting clients in identifying and practicing coping strategies. You don't need to reinvent the wheel. You might ask, what's helped in the past? Or what's one small thing you might try this week? This helps make invisible strengths more visible again and reinforces that sense of capability. Other Delphi endorsed actions included supporting clients in accepting hearing loss, referring to mental health professionals when appropriate, recommending books, articles, or peer support networks, and helping clients identify and draw on their existing support networks. The key message here is you don't need to fix everything. By offering one small strategy, validating a goal, or helping a client take the next step, you're already delivering meaningful intervention. Next, we move into the 7th Delphi domain, a key aspect of wellbeing focused care, connecting the client to additional support services. This domain is all about knowing when and how to guide clients towards further help, whether that's mental health care, peer support, or broader community resources. The Delphi panel endorsed 10 actions here, all highlighting the importance of creating clear, compassionate referral processes that feel supportive, not directive. Let's walk through the key behaviours highlighted here. One was for us to know our local referral pathways. Have a list ready with websites, phone numbers, funding information, and provider qualifications. Having this on hand makes it much easier to offer help in the moment. Number 2 is to gently offer options. Referrals don't need to be formal. Sometimes it's about planting a seed, like, would it be helpful to talk to someone who's been through something similar? Or, I've got a short list of options you might want to explore. Would you like to take a look at these together? Small nudges can make big differences. And the third is to normalize well-being help seeking as part of audiological care. Let's reframe seeking support as a strength, not a sign of weakness. We might say something like, a lot of people find it helpful to speak with someone outside of here, alongside what we're doing. Or, would you like me to show you a few trusted places to start? The core message here is you don't have to do this alone, and neither do your clients. Now, one of the most powerful and often underused support is peer support. Peer support groups are a valuable adjunct to audiological care because they offer something we as clinicians can't always provide. And that's the opportunity to connect with people who truly understand through lived experience. These groups offer practical knowledge on things like hearing aids, communication, and technology. They offer emotional support in a safe, stigma-free environment. And they offer a sense of community, motivation, and hope. They're especially helpful during early adjustment, but their impact extends well into long-term coping, self-identity, and even advocacy. It's not just clients who benefit. These groups can be a lifeline for significant others and parents of children with hearing loss as well. Peer support can take many forms. In-person chapters, such as through Hearing Link UK or the Hearing Loss Association of America. There can be online forums, such as Facebook groups or blogs, and even small clinic-based or locally organised groups. So here's a gentle nudge. If there's a group available locally, refer your clients to it. Even saying something like, would you be interested in chatting with others going through something similar, can plant a seed that help is out there and it's okay to accept that help. And if no group exists in your area, maybe consider starting one from your clinic. It doesn't have to be formal. Even a casual monthly drop-in can make a meaningful difference to your clients. When clients connect with others who really get it, they don't just feel supported, they start to feel understood, empowered, and less alone. As we move into the final Delphi domain, we shift from individual client actions to the organizational systems and structures that either support or silently undermine the delivery of wellbeing-informed audiological care. Wellbeing conversations are sensitive and they need to happen in the right environment. That means having private spaces where clients feel safe to open up, and appointment structures that allow time for these discussions to unfold naturally without being rushed. As clinicians, we can also be advocates within our teams and organisations, helping shape workflows and policies that enable this kind of care to thrive. Alongside this, the Delphi panel emphasised the importance of clear referral procedures for mental health concerns. including documented pathways to physicians or psychologists with experience in hearing loss, as well as protocols for responding to more serious concerns like suicidal ideation. When these systems are clear and visible, clinicians can act with greater confidence, and clients benefit from faster, safer support. This kind of work can be emotionally demanding, especially when clients are distressed or disclosing difficult life circumstances. And that's why the Delphi panel strongly endorsed the need for hearing care clinicians to have access to peer support, professional supervision, and regular opportunities to debrief and reflect. This isn't optional self-care. It's a critical part of working ethically, safely, and sustainably. In short, organisational systems matter. They can empower clinicians to meet the wellbeing needs of their clients or unintentionally create barriers. This final concept reminds us, good care doesn't rely solely on the individual. It also requires the right scaffolding around us. So as we wrap up, I want to leave you with this. Holistic care isn't about doing everything. It's about noticing what matters. The Delphi study was a collaborative effort, one built on the insight and expertise of clinicians, researchers, and importantly, people with lived experience. Across 8 domains, we reached consensus on more than 120 clinical practices, each one contributing to a shared vision of care that recognises and responds to the emotional and social needs of people with hearing loss. And what emerged was clear. There's no one right way to support someone, but there are many small, meaningful actions that we can take, from listening well to offering a brief strategy to knowing when to refer. These micro moments shape trust, safety, and healing. And this work isn't just about client well-being, it's also about clinician well-being. The study acknowledged that to offer this kind of care, we need training, scope clarity, support, and systems that make these conversations possible. So as you reflect on your own practice, I want to leave you with this. When we support the whole person, we elevate both the care and the outcome. You don't need to do everything, but you can do something. And often that small something is more than enough to get things started. Thank you for joining me for AIMER Video 10 today, the human side of hearing care, clinician qualities that can make a difference. In our next session, AIMER Video 11, we'll step into the 4th phase of the AIMER framework, encourage. We're going to explore how to embed the wellbeing support into everyday clinical practice, how to encourage clients to stay engaged with their goals and progress, and how to nurture hope, autonomy, and connection, even when the journey is challenging. Until then, thanks for making space for what really matters. I'll see you in the next video. Ciao.